This is Late Night Health. This is the radio program and video program that is concerned with the most important part of your life, your health. Hi, I'm Mark Alyn, and each week we spend some time with Dr. Greg Celaya. Dr. Celaya is a chiropractor and a nutritionist. He has a master's degree in nutrition and certified in a number of nutritional disciplines. Dr. Celaya, welcome back to Late Night Health.
Hey, Mark, how's it going today?
It is gorgeous, and while we are taping this, it's a lot warmer here in the western part of the United States than it is on the eastern part of the United States. Today we're going to talk about Crohn's disease. What is Crohn's disease?
Well, Mark, Crohn's disease was basically termed by Dr. Crohn, of course, just like all the rest of these weird diseases and organs and everything else. But it is an autoimmune disease. It's an inflammatory bowel disease that is caused by autoimmunity. And we have a higher rate of Crohn's disease in European descent, and especially more in the Jews.
Yes, Eastern European Jews have a higher problem with Crohn's disease and other gastrointestinal disorders. A lot of Eastern European Jews are also lactose intolerant. Is there any connection between lactose intolerance and Crohn's disease that you're aware of?
Well, we haven't seen that type of connection, but for somebody that has Crohn's disease, we're taking them off of dairy. So right. Coincidence or not, it's hard to say, but there is a genetic component. You have the NOD2 and the CARD15 gene that we see in Crohn's disease. And go ahead.
I was going to say, right now there are a lot of ads for DNA testing, ancestry testing. Is that something that people should do? I know you're really big on testing to find out about those genetic markers.
Well, I love genetic testing, and I do a lot of genetic testing. The thing you have to understand, and we've talked about this before, but you have genetics and epigenetics. Just because you have the genetic trait, like, for example, those genes I mentioned, doesn't mean you're going to get the disease. The disease depends upon the epigenetics, what you do in your lifestyle to be able to realize that genetic trait. So even though I like the genetic tests, I have to make sure that people understand that just because they have a genetic trait for, let's just say, diabetes, it doesn't mean that you can just blow off life and you're going to get diabetes as a result of or being healthy and getting it. So it really depends what you do as far as if you realize that genetic trait.
So if you have that genetic trait, you can overcome it by diet, supplementation, exercise.
Yeah, it's a hard one because you have to live a little bit more of a perfect life, right?
Right. Let's talk about the symptoms of Crohn's disease. I know that it can be quite painful. What else is associated with it?
Gosh, there's so many things. I heard somebody saying it's from your gums to your bum, right? Any type of symptomology. You can have tenderness, you can have masses, abdominal pain, diarrhea, stools that are greasy, nausea, vomiting, fever, night sweats, loss of appetite, weight loss. There's a type of discoloration you get on your shins. There's skin sores, difficulty urinating. I mean, the list goes on, but it's inflammatory.
At the same time, isn't it true that with Crohn's disease, it's hard to control your bowels?
It could be. I mean, really, almost anything you can imagine, like I said, from your gums to your bum, is a possibility.
Wow. You and I, before we started looking up Crohn's disease, and I guess it was first looked at in the 1600s, late 1600s, by an Italian physician. And then I guess it was in the 30s, it was actually named. What can we do to avoid Crohn's disease?
Well, first off, you have to look. Of course, genetic understanding is an important scenario. Number two, there's different causations of this. So basically, there's a few different ideas. There's an idea that we have specific microbes in your gut along with your genetic susceptibility that trigger an autoimmune response. And so there's certain different bugs, so to speak. So you have Candida tropicalis, which is a fungus. And by the way, there's 20 different species of Candida, just so you know. And they found that it's grouped with an E. coli and another bacteria that form a thick biofilm. And they're thinking that may cause a susceptibility of an increased immune response.
What is biofilm?
Biofilm is just like a thick layer on a surface that's loaded with different bacteria, and in this case, a fungus as well. And so basically it causes an immune response due to your body not being able to eradicate it. So sometimes your good bacteria has a hard time getting through the biofilm as a result.
Would biofilm be something like when you wake up in the morning, right?
There you go. Yep.
It's in your mouth and you go blah, 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 blah.
Yeah, you could say it's very similar to that, but it's, intestinal. So you're seeing the thickening more than normal. There's also then a understanding that you have something else called the Mycobacterium avium paratuberculosis, which is hiding in your white blood cells, and therefore your body starts to attack, part of your system because the white blood cells aren't necessarily working right.
You did say the word tuberculosis. Is that?
I did. It's paratuberculosis, and just people named all these bacteria and virus kind of crazy. So it's just another form.
It's not the tuberculosis that the lung tuberculosis then.
Well, it's not necessarily the same strain, but they call it paratuberculosis. It's probably very similar in certain factions.
I see. Well, we know that, and we've discussed this before, that some microbes, some bacteria are good. They're good flora, if you will, to have in your intestines. When you have Crohn's disease, is there an abundance of bad bacteria?
Yeah, and that's what they're finding. It's real important to make sure you have a good level of the healthy bacteria. Also different virus. For example, Epstein-Barr virus, you're seeing that in about 63% of Crohn's disease. And is it an incidental thing? Meaning, does it cause Crohn's, or did Crohn's cause it to be more prevalent? Don't know. But yeah, you have to make sure that you're taking care of your bacteria so they can keep the bad guys at bay. Right? Does that make sense?
Absolutely. What about using probiotics to increase the good stuff and to fight the bad? Is that a good idea?
Yeah, absolutely. It's a good idea. But I had a phone conversation with somebody the other day, and they were very curious if too much of good bacteria is a bad thing. And they are. It's the same thing. You don't want an overabundance. It's kind of like what I talked about before, cops and robbers, right? For everybody for the system to be working, you have to have a fair amount of each to be able to take care of each other, right? I don't know if that makes any sense, but if you don't have the bad guys, the cops have nothing to do, right?
All right,
and therefore you end up losing police force as a result. And then the bad guys can take over. So
or the police force will take over. What about the getting rid of some of these bad things like Epstein-Barr, the virus, which up until recently, many traditional doctors didn't even believe was a disease, was a problem.
Well, Epstein-Barr and all these viruses, Mark, we probably need to do, in fact, I probably need to do just a separate show just on virus. If you look at how virus work, it's pretty amazing. Some people even think that it could even possibly be extraterrestrial. I mean, that's how viruses work. They're pretty wild, and we probably should discuss that in depth one day.
The virus from Mars. I like that. Viruses don't fit into other categories. Animal, plant, bacteria are a form of a plant life, if I'm not mistaken. But viruses are completely different than other life forms. Maybe you're right. Maybe they are from outer space.
Yeah, it's a whole conversation all to itself. But, going back, if you don't nourish your gut microbiome, meaning you have to feed them, just like you would feed your animal to take care of them. If you don't feed them right, they're not going to flourish. And if not going to flourish, they're not going to keep the good or the bad bacteria at bay. You have to make sure to keep them healthy. And you have to make sure to have a real broad diet to help do that. A lot of different fibers, a lot of different nutrients as well.
We talked about ulcers a few weeks ago and how the treatment was drink a lot of milk because the milk would ease your stomach, and eat relatively bland food. Is that something also that should happen, that you should do with Crohn's disease?
Well, I don't know who talked about that, but it wasn't me, because I'm not going to tell somebody to go drink a bunch of milk. And
oh, no, I agree with that. No, what we said was that's how they used to treat it in like the 40s and the 50s if somebody had an ulcer. But today we know better.
Oh, there's so many things to do. One big problem is if you do have any type of ulcerations or bleeding, you may become deficient in so many nutrients that you need to help heal you from this disease. So it becomes like a vicious cycle, right?
Right.
Due to these infections, you can have iron, vitamin B, vitamin B12, folate, calcium, vitamin D, magnesium, zinc, vitamin A. You have protein issues, amino acid issues. And so we have to make sure that we fortify or nourish our system while we're working with the Crohn's disease to make sure that we have the ability to heal as well.
Is there a test, an actual test for Crohn's disease that says you have it, or is it just based on symptomology?
Well, it's kind of a combination of both. So there's no one specific test for Crohn's. You can have a scope which can make a difference, but sometimes the scope doesn't hit it all. There's different markers we look at, and the combination of those and the symptomology, we can see or term it Crohn's disease.
Gotcha. A lot of people with Crohn's disease don't travel far from a restroom.
No, and I see it all the time. I mean, there's certain tests that I like, and there's a GI profile where we look at the viral, bacterial, and fungal infections. We look at DNA. We tend to look at what good and bad bacteria that you've got going on, and the ratios of them as well, which is really important. We tend to look at inflammatory and digestive markers as well. And so we have to make sure to really understand what's happening to be able to treat it. You mentioned probiotics before. Probiotics are great, and it really depends on the different probiotic and the deficiencies that you have. Sometimes just taking a broad probiotic may be good, and other times it may not be.
And you need to be tested to determine what you should use and what you shouldn't?
Right. I mean, sometimes we'll see an overabundance of the good guys, and that's a bad thing too. So we have to make sure that we are supplementing the right way. Otherwise, you're just kind of guessing.
Crohn's disease, as we mentioned, can be painful as well. What do you do about the pain?
Well, it can be painful, and the whole secret is to make sure to minimize it. So diet is extremely important. And we'll put patients on an autoimmune type of diet, which is going to be really important to minimize the inflammatory responses that we see. You're going to have to get off the coffee, the caffeine, the no milk, the no sugar. Other things that can help are bone broth and collagen, HCl, so digestive acid and enzymes can make a big difference. The different probiotics, also relaxation, meditation, all that stuff makes a big difference.
What else can you tell us about Crohn's disease as we wrap up our interview program chat today?
Well, here again, it's an autoimmune disease, and just treating it or treating the symptoms, right, like you mentioned, something to make you a little bit more comfortable, isn't going to fix the problem. So just making sure that you don't have symptoms isn't fixing anything. And you have a 70 to 90% likelihood of gaining another autoimmune disease if you don't treat the actual cause. So treating the symptoms doesn't fix the problem. So if you're asymptomatic, it doesn't mean that you don't have an autoimmune problem. And so that's probably the most important thing, is getting down to the root cause and working with it. And working with Crohn's, it's not easy. It's not easy for the patient. There's a lot of changes that need to happen. But it's not uncommon that we can get people asymptomatic and doing really well for quite a long time, right? As long as they keep the program, they keep working and dealing with it.
Yeah, the idea that patients are compliant is one of the biggest problems that health practitioners across all spectrums of healthcare have.
Yeah, of course. And compliance is an issue. I mean, but when they're not compliant, they're the ones that are going to suffer, right?
Right.
The average person going into hospital for Crohn's, the average price is about $37,000 going into the hospital. It's anywhere from, 13 all the way up to 60 to deal with Crohn's for hospital stay. So,
Whoa.
in addition to, there can be surgical removal of these areas, because usually your intestinal system will have areas that are infected, so to speak, or inflamed, and others that aren't, and then another part that is. So it becomes a real big deal for a lot of people. And some people can even have obstructions due to scar tissue from this as well. So it's something you don't want to go down this path. You want to deal with it the right way and quit treating symptoms, because it's just a matter of time.
So test, and test again.
Well, not only test, but then you have to act, right? You have to work to actually work on the causation. And that's where a lot of people fall short. They don't work on causation.
Gotcha. Dr. Celaya, thank you very much for joining us again here on Late Night Health. We appreciate it. If you want information on Dr. Celaya, visit him at his website, drcelaya.com, drcelaya.com. Look around. There's a lot of great videos, lots of articles and blog information, as well as the ability to have a free, absolutely free, 15-minute conversation and consultation with Dr. Celaya. So be sure to take a look at that, drcelaya.com. And of course, visit us at latenighthealth.com as well. Dr. Celaya, thank you for your time today. We appreciate it. And we'll see you on our next episode. Bye-bye for now.